Welcome back. In this episode of Rehab Addicts, we are going to go through the knee. The knee is essential for proper lower body locomotion. Why do we like the knee so much?
Well, if you got a bum knee, you ain't getting very far.
Exactly. The knee goes through an amazing amount of work that we really don't think about on an average day. The average person takes 10,000 steps in a day, divided by 2, that's 5,000. You do the math over a lifetime. When you get to about my age, 40, you've done about 60 million revolutions in the knee, and you start to wonder why you're having a hard time going up and down stairs.
Not to mention, people love running, which is even more pressure and wear and tear on the knee. What machine can do 60 million revolutions without breaking down?
Zero.
Yeah, zero.
Nothing can do that. And that's why we have to manage the knee on a regular basis. First things first though, you have to get to the hip. You know what? We talk about the hip a lot.
Yeah.
Why do we talk about the hip?
If your hips are bunged up, nothing's working well.
Right. The hip basically loads the back and the hip loads the knee. It's the connection point between the two. And so if your hips aren't fixed or corrected, go back to one of our previous videos down low, and we will get you fixed up there, and then move on to the knees. All right, just remember that little tidbit. Bad hips will be bad knees.
Yeah.
Okay, so without further ado, we have 2 tests that we globally screen our patients for bad hips. First one is the squat, and the second one is the lunge. So let's go through the squat first.
Yep.
Hayden's all painted up, and we're going to go through what a normal squat looks like here. So as Hayden goes into a deep squat, he's keeping a nice lordosis in his back that we covered in one of the hip videos, and he gets down there far, people, because he works on his mobility. There's some mobility people who spend hours in this position every day. This requires a significant amount of hip flexion and knee flexion to be able to get into that position. What we're looking for here is that he's getting a good amount of knee bend in this position. He's able to keep a good lordosis in his back, and little tidbits other than that is he can flare this out, which shows good internal external rotation in the hip, stuff like that. All right, that's a good amount of squatting. Now, most people probably can't do that, right?
Definitely, yeah.
You got to work at that to be able to do that. This guy's doing that 8 hours a day. He doesn't really have a job. That's all he does. So,
I just squat all the time.
yeah. So if you're the person who's going to squat and you can't get into that, there's a couple things that are going to happen. So let's see a bad squat. He's going into a squat. A couple things are happening. A, he's pretty apprehensive. He can't get down there. He might not have a lot of knee bend or hip flexion. The glutes might be feeling like they're getting all tied up into here, and his back could be rounding out just because he doesn't have the range. Another interesting thing that you see with a bad squat is as somebody's going down here, their toes are actually coming up because they don't have the range in their ankle dorsiflexion, and what ends up happening is the extensor muscles in the leg are trying to pull that forward, and it's just not working. So that's an abnormal squat. Once again, you guys should be able to get down there deep. You should be able to hold it. In an abnormal squat, a couple things that we're looking for is pain and tightness.
Yeah.
Right? Where are you going to get some pain and tightness?
Probably right at the knee.
Yeah.
Right?
The knee is a hinge joint biomechanically. And if you have tightness in the quadricep muscles, then it's likely going to present in the knee, and the knee's not going to be bending. And you're going to feel like your knee's going to explode if you have a lot of ligamentous tightness. All right, second test that we do. If you've got that one cleaned up and you feel okay with that, that's more of a stable test. We do a more dynamic test, which is a lunge test. And I'm going to have Hayden start back on the wall. What he's going to do is he's going to go into a lunge, and you're going to lunge forward with that left leg, and that's going to dynamically put his knee into load. So all of a sudden his knee has to support his body weight on one side. A good lunge, what you're going to end up seeing is he's coming down. His knee isn't all rickety and bending all over the place. His foot's not pronating in, and his knee's basically stable right over his big toe. and his body's upright. He's maintaining a good amount of posture. If you can do one of those, do 5, do 10, do 20, and see how your knee is able to deal with that increase in load over time. What you're going to see, if you have any amount of dysfunction or lack of mobility in your leg, it's going to start to present after those increase in repetitions, because those tightnesses are going to start to just show up. All right, if you come out of this, I'm going to show you one more thing. When come back and we're going to lunge one more time. When somebody lunges, when their foot lands, and you might not be able to see this well, but when their foot lands, sometimes they land directly on their toes. So if this is the ground and this is my foot, they'll land directly on their toes, and they don't land on their whole foot. And when they go to push off, they push off with their toes. Typically that means that you're really quad dependent and you're not using your whole kinetic chain. And that's not good, because that means you're loading specific areas.
Yeah, you love those glutes and hamstrings, right? Use them.
Yeah. Biggest muscles of your body, they got to be part of the actual range of motion here, and they're what stabilize the knee. So once again, if they're not cleaned up, you guys got to go back to them. So you've uncovered that you have a little bit of tightness or a lack of what?
Mobility.
Mobility, our favorite word.
Yeah. In
the knee, what are we going to do? How are we going to assess it? Where are the areas that are typically involved? So in the leg, we sort of break it down into 2 areas. We have the muscles, and then we have the ligaments and tendons at the kneecap. So we've got it drawn up nice here. The vastus lateralis is in purple, the IT band is in fuchsia, and the rectus femoris muscle is in green, and the VMO is in orange. When you're getting VMO muscle pain, it typically refers down to the inside of the knee. When you're getting rectus femoris pain in green here, it's shooting down into the top of the kneecap. When you're getting vastus lateralis, which is interesting because almost everybody thinks that this is the IT band here. The IT band's a bit further back. You're getting pain traveling down the side of your leg. So when you guys are rolling the side of your leg, very often you're hitting this big muscle of the body. Little known fact about the vastus lateralis, it's the largest muscle in the human body, bigger than these guys even. So this guy needs a lot of work to be cleaned up. This guy refers down. When we get directly into the kneecap, the interesting thing is we have about 4 areas where tendinitis and ligamentous scar tissue develops. It develops in the suprapatellar region, the infrapatellar region, right below the kneecap. And these 2 tendinitises are the type of pain that you guys typically are going to feel going up and down stairs, hiking up and down a hill, and doing squats. Right? The medial retinaculum is the tie-in of the VMO on the inside of the knee, and the lateral retinaculum is the tie-in to the kneecap from the IT band. And so those are the areas in the actual kneecap that are really, really tight and lack mobility and have scar tissue. We're going to follow this video up with the subsequent mobility video that you guys need to do to clean up, whether it's in the muscle or the knees. This is our basic biomechanics video. We're going to be back with an advanced biomechanics video that covers some of the other ranges of motion, like terminal knee extension and rotation. Anything to add, fine sir?
Yeah, we're going to be doing a lot on the knee, so stay tuned, and we're going to really show you how to clean up your knee and get it feeling good.
Yeah, we're going to get you guys' knee moving well so you guys can do the sports that you guys want to do and have a pain-free lifestyle.
That's what it's all about, man.
All right, dude.
Yep.
We're up from here. Check us out on YouTube, subscribe to our page, and we'll be back with the follow-up video that you guys can fix your knee.
Yep.
We're out for now.
Okay.